Everyone, so in this video we are going to talk about patella fracture, a common fracture that can occur following an RTA or a fall. This fracture can occur either due to a direct force or due to an indirect force. A direct force can occur when there is a blow on anterior aspect when the knee is flexed. Say the patient is on car and there is a bumper injury. It leads to a patellar fracture. It can lead to a tibia ACL tear, or it can lead to fracture in upper part of tibial spine. So right now we are talking about patellar fracture. The bumper injury may cause a patellar fracture due to a direct force. This may lead to a comminuted fracture. Now the comminuted fracture may be limited to a part of patella or to the whole patella. In case it occurs in our whole patella, it is known as stellate fracture. The patellar fracture can also occur due to indirect force. When there is a sudden contraction of quadriceps muscle, it leads to a transverse fracture in the patella running from one side to the other, dividing the patella into two parts, and it is known as two-part fracture. So a direct force causing a stellate fracture and an indirect force can cause a two-part fracture of patella. The patellar fracture can be either displaced or undisplaced. Now we know that patella is actually a sesamoid bone that is formed in the tendon of quadriceps femoris. Before insertion of quadriceps femoris tendon within the tibial tuberosity, okay, say this is the tibial tuberosity. Before insertion of quadriceps tendon into tibial tuberosity, the sesamoid bone patella is formed within the tendon of quadriceps femoris, and this will be gets surrounded by patellar retinaculum. Now the fracture is prevented from being displaced either by prepatellar expansion of this quadriceps tendon or the patellar retinaculum that surrounds it by side and gives a sidewise stability to the patella. In case there is a very severe injury and sudden contraction of quadriceps, there is tear in patellar retinaculum, then there is displacement. Otherwise, the fracture is prevented from being displaced by prepatellar expansion and patellar retinaculum from sides. Clinically, the patient will have pain and swelling over the knee. A crepitus may be felt over the site of fracture. The gap will be felt if the fracture is displaced. Okay. Now, if there is extensor leg, that is due to deficit in the extensor apparatus, that is quadriceps femoris patella and its insertion, the patient is not able to lift the leg in full extension. If there is a direct injury, the bruise mark may be seen over the skin over patella. A swollen knee may indicate hemarthrosis in knee joint. Going into the x-rays in patellar fracture, we go for an AP view, lateral view, that are easy to understand, but a skyline view. See in this image, this is how skyline view is taken with knee in semi-flex position. The x-ray beam go from this side and the film is placed on the other side. In many of the cases, comminution may not be seen in x-rays too, and while operating, comminuted fracture are found. The treatment involved, the treatment of undisplaced fracture is by cylindrical cast that goes from groin area up to the above the malleoli, and this cast is applied when the patient is in full extension. Okay, this cast is applied in full extension above the malleoli to the groin, and this cast is applied for 3 weeks. This cast is applied for 3 weeks and relief of pain is given by analgesic. In case there is two-part fracture due to sudden contraction of quadriceps, we know the pull of quadriceps will not allow to maintain the reduced position of the patella. So we have to fix the fracture site, and this is done by tension band wiring. This tension band wiring is applied in the form of figure of 8, okay, to fix the patellar fracture. If no reduction is possible, either we excise the patella, that is known as partial patellectomy, and we apply the cylindrical cast again for 5 to 6 weeks and in the extension position, and let it heal. We also heal the surrounding patellar retinaculum, that is extensor retinaculum surrounding the patella. Third case, that is comminuted fracture. These cases the patella is comminuted. If there is a stellate fracture, say, there is the repair or the fixation by tension band wiring in many of the cases not possible, and if done too, it can lead to osteoarthritis due to patellofemoral osteoarthritis. So we actually do patellectomy better than tension band wiring in many of the cases to prevent patellofemoral femoral osteoarthritis. So this was a bit about patellar fracture. Hope you liked it. Thanks for watching.